Good day. I am Dr. Alvarez and I will be performing the physical examination of the nose, particularly the anterior rhinoscopy.
So this is the headlight, which is the light source that will be placed at the back of the patient at his or her right side. The head mirror, in which the light will be reflected from the mirror onto the nose of the patient. This is the nasal speculum. This will be used to examine the internal part of the nose. First, we turn on the light source and then put the head mirror. Place the mirror over the left eye. Close the right eye and adjust the mirror so that you can look through the hole directly on the patient's nose. Now adjust the light and mirror until maximum amount of light is reflected onto the patient. When the right eye is opened, you should have binocular vision and the reflected light should be shining to the patient's nose. The focal length of the mirror is approximately 60 centimeters. This means that the reflected light will be the brightest and the sharpest when the examiner and the patient are this distance apart. The first part of examination is inspection. Using a tip applicator, we check for external contour, any external nasal deformity like saddle nose or crooked nose in the external nasal area. And then we check for the alar area of the nose. First, we're going to check for tenderness.
Do you feel any pain or tenderness in your nose?
Then we stabilize the head and then gently palpate the nose. We check for any nasal crepitus, mass, or any swelling. Gently lift the anterior part of the nose and see the vestibule. Look for signs of vestibulitis, septal hematoma, or polyps hemangioma. Going to check for the patency of the nose, by standing in front of the patient, we ask the patient to occlude his or her right nostril using the right index finger and ask the patient to breathe normally to the right nostril. We repeat by occluding the left nostril using the left index finger and ask the patient to breathe normally through the left nostril. Normally, the patient will be able to exhale through the unoccluded nostril. When examining the internal part of the nose, we're going to use the nasal speculum. It is held by placing the index finger onto the tip of the nasal speculum. We ask the patient to put the head back, then insert the speculum into the vestibule. It is important that the speculum should rest against the ala of the nose, not the septum, because it might cause pain to the patient. We insert the speculum into the vestibule. It is important that the speculum should rest against the ala of the nose, not the septum, because it might cause pain to the patient. And then push the speculum slightly outwards and then open it wide without causing any discomfort to the patient. We bring the light source to check for any signs of bleeding, deviation, or if there's any fracture, and look for septal hematoma. Then look for inferior turbinates, checking for things like allergic rhinitis. Look superiorly for the middle turbinates and the space beneath the middle turbinate, referred to as your middle meatus. When we're done examining the nasal cavity, it is very important not to close the speculum inside the nose, as nasal hairs can be grasped between the tongues of the speculum, and if one pulls out, it will cause the patient sniffing pain. Now, when removing the speculum, just close slightly but not all the way, leave it open, then pull it out. It is also important not to forget to repeat the procedure on the other side of the nose. nasal speculum is not available, you can use your otoscope. Use the thumb to lift the tip of the nose, insert the otoscope, and then examine for structures that was mentioned earlier. And that is how the anterior rhinoscopy is done. Thank you for watching.